welcome to you both of Santa Clara Valley Healthcare's first podcast. I'm so excited to introduce you both, Natalie and Samia, to episode 1, highlighting our OBGYN residency program. I'm Nick, and I'm the multimedia communications specialist at Santa Clara Valley Healthcare. And my job is really to help highlight all of the things going on at the hospital and clinics here through visual media. And today we're doing a podcast to show not only prospective residents what coming to this program will be like, but also to the community that you serve, the care that they receive when coming to our premier hospitals and clinics. So welcome to you both, and feel free to introduce yourselves.
Do you want to go first, Chief?
So my name is Natalie Eggleston. I am non-Californian by origin. I'm actually from Wyoming originally. I grew up in Wyoming, left for college, did some college sports back in the day. And then I went to University of Washington for medical school through kind of a rural health, underserved pathway. I also studied Hispanic health and healthcare disparities as kind of a emphasis during medical school, and then came here for residency. And I've been here just over 3 full years. I'm now in my 4th year. And excited to be pursuing life outside of residency as a OBGYN generalist.
Wonderful. Thank you. Welcome. And Samia.
Hi, I'm one of the newest members here. My name is Samia. I am a first-year resident. I am originally from Southern California, not born, but pretty much raised. And then I lived here my whole life, went to undergrad here, and then moved to Boston my last year of undergrad. I did an exchange program, stayed for grad school, worked for a little bit, and then moved to Detroit for medical school. And I was there for the last 4 years. I was kind of tired of living in the snow and was ready to come back home to sunny California. And so I was pretty committed to returning back to my home state. So very happy to be here. One of the things that attracted me to this program was the fact that it was a county hospital and it cared for a largely marginalized patient population. I think that's something that I felt was very much in line with like my own personal goals and type of patients I wanted to treat in the future. And so I wanted to end up at a program that was caring for that type of patient population.
That's amazing. And you read my mind, because that was going to be the next question of really asking, of all the places that you can do a residency, really why here? You mentioned the weather as one of them, but also really the patient population as well, which is just amazing. I hear that a lot. Natalie, would you also care to tell us why this was attractive to you?
Yeah. I was nodding the whole time, hearing what Samia had to say. I think a lot of the very similar things attracted me to this program. I, personally have always really loved working with Spanish-speaking patients. So I looked at a lot of programs, that offered that patient population. And this was a great program in those regards. Again, working with patients that tend to be kind of on the, margins, as you said, of healthcare and are often falling through a lot of the gaps, sometimes in like societal resources and programs and things like that. I think it's just a very meaningful way to apply kind of our medical knowledge and really make a big difference for a lot of people. And I think every year that I've been here, I've just been so amazed by, the incredible resiliency I've seen in patients. And it continues to be a more and more rewarding place to be day by day.
That's amazing. And through my work, interviewing people for videos, talking with many residents about why they choose to be here, and hearing that it's a county hospital and we care for everybody, regardless of immigration status and insurance status and all of that. So that's really amazing to hear. And it's just so cool that talking with people so separately, it's always so similar of answers. So our hospital is right in the heart of Silicon Valley. How would you describe the type of program it is versus, a hospital or a medical facility in another place?
So our program is, like you said, it's a community program. It is distinct in that it's not, we don't have a particular university that we are fully under, but we are affiliated with Stanford. So we're a university-affiliated program, and that provides a lot of opportunities to us as residents and to our patients as well, in that, we do have some fellows that come from Stanford that get to work with us. They're not our fellows particularly, but we do get to learn from them, both surgical skills. They do teaching for us, and that's in our GYN Oncology department as well as family planning. And then the other thing that we get from Stanford, that we all run into all the time is our lovely medical students. And I think for me, I really wanted to come to a program where I had the opportunity to teach. I like teaching. I think it helps keep, me motivated and relevant. And I love, having people learn new things and practicing those skills and, getting excited about them. So the Stanford students are, really a pleasure to work with. And I learned so much from them and get to utilize and kind of build that skill. And then it does also provide research opportunities. So if you're interested in doing research, reaching out to Stanford to be part of bigger projects as a resident is always possible. Also, if you're interested in fellowship, people will do like extra away rotations in certain fields to try and get extra experience and exposure, with the population at Stanford, and network with those people. So that's a huge benefit as well.
I think it's really cool that we're able to interact with people who are at an academic institution, and there's a lot of opportunity for like cross collaboration and like interdisciplinary learning, and that's really great. That was something that was really attractive to me when I was applying to the program, that you had these 3 independent residency programs, but then all other services were run by Stanford residency, fellowship, or just like regular attendings that were under the Stanford umbrella.
Yeah. And then that kind of brings up, a big changes you've kind of been introducing. We are Santa Clara Valley Medical Center, but we also have additional hospitals that have now been added into the enterprise, that we as residents are now having opportunities to also go and work at those other locations. And that's something I've also seen change during my residency. So I think one big advantage, as you mentioned, is like we are the OB/GYN residency at Santa Clara Valley. So you do a majority of your surgeries, you do all of your OB experience, and then you only cover the ED here. So, you get to know people really well. Like I know the OR staff really well. I know the labor and delivery nurses really well. They all know the attending. So it's that contributes to that kind of familial atmosphere we were talking about before. But now kind of getting to expand to these other places, it creates new opportunities. You have more surgical volume. You get to kind of experience, what a slightly more like privatized hospital feels like as a surgeon. And it's really also provided a lot of access for our patients too. So I think we get kind of the best of both worlds. We get a home base, a really solid home base, but then like some exposure in other places as well.
That's amazing. You do have such cool opportunities for collaboration with Stanford, like you said, and then also opportunities to see and provide care at our other hospitals, O'Connor Hospital in Santa Clara, as well as St. Louis Regional Hospital in Gilroy. So that's amazing. Moving on to, we'll come back to patients, but also the people that you work with, and talking about Silicon Valley, but also the hospital. What would you say the culture is like here as a place to work too, both in a medical sense and in just a daily living sense?
Well, you've been here longer, so maybe you can start.
I think so. I've been involved in the recruitment process for the residents pretty much every year. Even as an intern, I was like right away, like, oh, I've got a lot of really good things to say about the program. I want to get good people here, because there already was such good people and such a good infrastructure. And so I think one of the things I've always highlighted about our program, that really is distinct in a lot of ways from other residency programs, is that we are very non-hierarchical here. And I think Samia and I were joking about that. She's like, oh, we have the intern and the chief here, and you can see, on the video podcast that I'm not afraid of her. I think that'll tell people a lot of things. I mean, she should be afraid, but that's her choice, I suppose. But it's really true. I think all the way from, there's no job that's like too big or too small, whether you're an intern, a chief, an attending within our program, within our department, that everybody's willing to get their hands dirty to help, get our patients the care that they need, no matter what it is. And in doing that, we all have such a common goal. I think it really does cultivate strong bonds, again, between us all. And I really do, count the residents as some of like the best friends that I've had. And even the attendings, I think we have a very personal relationship, which is definitely something that I was seeking out of residency. You want to be with people you enjoy being with. It makes all the tough things about working in a hospital and, working residency hours worth it.
What a testament to the place and the people here to really have you say such high things. And Samia, being here for less time, have you still been able to experience some of those things that Natalie was talking about?
Yeah. So I was not, unfortunately, able to visit the hospital in person and meet everyone in person during my interview time. But when I got here, I 100% support everything that she was saying. She's right. There's very little hierarchy in the program. Everyone gets along really well, all the way down from the attendings to even me as an intern. I always feel like I'm part of the team, and I never feel like anyone is like asserting their authority over me, although they do have more authority, but I don't feel it. I think something that I really appreciate in this program in terms of culture is how willing everyone is to empower everyone to do a good job and take ownership of patient care and really do the best for our patients, all the way down from a medical student to an attending who's busy and carrying a much larger workload. So I appreciate that. I think it's really great for my learning how much the chiefs all support me in learning how to care for patients and taking ownership of my duties as a resident.
And you both have now talked about kind of that lack of hierarchical way of learning, the lack of, I guess, that would be in a negative sense, and the support that you've received from both chiefs and attendings alike. In what ways do you feel that is it a matter of the cases that you see, the just the independence that you have as healthcare providers? How do you really feel that support from those who have been here, maybe longer and have, things that they can teach you?
I think it's both. It's the independence, and I think it's also the working relationship that you have with more senior residents and also the attendings. There are times when you're on, so far that I've been on a rotation, and it's been me and an attending working together, and the way that they view me is we're working in partnership together to take care of a patient. They have more experience and expertise, and so they're supervising me, but it's almost like they're supervising me so that I can learn, but we're still working towards the same goal. And so I really appreciate that. It makes me feel like I'm welcome into the learning environment.
I think one thing that I remember asking, which I don't think I fully comprehended when I was interviewing, like what this exactly means, is this balance between support and autonomy. Because when you're becoming a doctor, you kind of are coming into this role where all of a sudden you go from being a little bit of a nobody as a medical student to like now you're, sort of in charge, and, the nurses are looking to you for answers. Now your attendings are even looking to you for answers. And so as you're coming into this role, you kind of need somebody to help you and to guide you, but also to, help you to feel confident when you know what you're doing. You can bounce your ideas off of somebody, but then to have someone say like, no, you're doing the right thing. Like, go do it. Be brave, move forward. And I think that our program does that really well. There can be times, where maybe that balance isn't there. In other places, that's one thing I was worried about is, am I just going to be tossed into this environment that I don't know what I'm doing? And I'm, obviously we want to care for people in the right way, but I think they balance the support. We always have somebody to look up to if we need extra help. The hospital itself has incredible resources. I think that's one thing that also took me some time to appreciate, being at a level 3 trauma center with a level 1 NICU. especially for being in labor and delivery. Like there's almost no patient we can't take care of, like very few, very specialized things, but we can really take care of almost every patient that walks through the door. So we're supported in such a multitude of ways, but are also taught how to, become the physicians that we're hoping to become.
That's incredible. And regardless of who I've talked to here, whether it's a radiology resident, they've always said maybe in other places they wouldn't get the hands-on experience that you really are afforded here. What allows for that? Is it just a matter of, trust and independence? Or, I know that your residence here, so maybe you can't speak to other places, but why do you think that is such a feeling here that you really do get that support and that independence to take care of any patient going through anything?
One thing that I've noticed is that there are no fellows, at least in our program. And so we don't have anyone to default to say, okay, this is a more complex case, or this is a case that fits more into your specialty area. So you should take it over. We are expected to take care of any and every patient that comes in that requires our medical expertise. And so I think that adds a lot to why we're able to have really great exposure, hands-on patient care, and a wide breadth of experience when we are going through residency. I've noticed that a lot of the attendings do surgeries that I was under the impression were surgeries that you needed a fellowship in order to be able to do them. But because of the type of setting that we're in and the type of training that we get, they feel comfortable doing those types of surgeries. And I think that's really great. And it makes me feel really excited about what type of training I'm about to get over the next 4 years and what type of skills I'm going to walk away with at the end of residency.
Yeah, I agree 100%. And one thing that makes our program really unique, just bouncing off of what you said, is that, we are in a large metropolitan area with a lot of resources, but a majority of our, especially surgical attendings, are generalists. And so they, as time has gone on in the field of OBGYN, things have become much more kind of subspecialized, and procedures are getting a little bit more siloed, especially in bigger metropolitan areas. But I think that, one of the major strengths of our program is that we train really, really good generalists, people that are very comfortable doing vaginal surgery, laparoscopic surgery, open surgery, even oncology to some extent. Obviously, that's the most specialized, but the complexities that come with those types of surgeries, and then now robotics as well, and all from a majority generalist standpoint. Now that's a huge thing, when it comes to recruitment, is people are wondering, what comes next. A lot of people are geared towards doing fellowship for various reasons. And we do have a lot of residents that go on to fellowship. A majority of them do go on to be generalists. But we placed somebody last year in MFM specialty. The year before that, we had family planning. We have had lots of patients go on to minimally invasive gynecologic surgery specialties or fellowships. And I think we still haven't had anybody for REI yet, or GYN Oncology. But, I would say about 25 to 30% of our residents do go on to fellowships. So if you want to be a generalist, it's a great place to be. If you're interested in fellowship, it's still a great place to be. We have a lot of the resources and the training that you need to be able to go and do that if that's what you want. And I think that the program does its best to support people in those efforts as well.
And now you both have talked a little bit about, not only do you have independence to do certain procedures, and now a little bit about the specific procedures that you do get to do. Can you discuss a little bit about the cutting edge technology that you get to utilize and practice on? I know I've had the opportunity to film people using the Da Vinci robot, for example, and then also more of the specific cases that you do get to be exposed to here.
So I was on GYN with her it was a month ago.
Yeah,
and
it seems like ages, huh?
I had the opportunity to go and start learning about the robot. The way it was proposed to me is that it's great to start seeing how the robot is set up, and just getting a feel for like what it's like to be in the room with the robot.
It's a large presence.
Yeah. So that, as the years go by, I feel more comfortable and I feel more familiar with all of the different working parts. And I think that's great. Like, I definitely don't feel comfortable enough to do anything. But at least like I'm becoming more familiar with robotic surgery. So I think that's one of the cutting edge technologies we have. And then
Before we go any further, can we just tell people who may not know what the robot is? I don't know. It may sound...
No, it's so funny to explain to people, if I'm like, oh yeah, like had a robotic case today, and they're like, so you were on the beach and you were just doing surgery like from your towel? Like what do you mean robotic surgery? Like, are you in the hospital? Like basically, robotic surgery is utilizing a large machine that has multiple, like more points of articulation. And so you're able to do a lot more finer movement. As compared to laparoscopy. So laparoscopy and robotics share that you make very small incisions and you basically inflate whatever space you're using to create space so that you can see, and you put a light in there. But it avoids needing to do big incisions to just see everything exposed. And then if it's laparoscopy, you kind of only have like, you have a stick that can basically, since we have a video, I can say the stick really only has like your wrist and your hand to articulate. So it kind of only can go like that. But with the robot, you almost get like more of a full arm. So you have like articulation at like a finger level, like a wrist level, and then back kind of maybe at like the elbow and the shoulder level. So you can work in much finer planes. It's less physically taxing for the surgeons. And, it's interesting to think about robotic surgery in the field of gynecology. I mean, that's its own podcast episode in and of itself, because there are like kind of some indications that make a lot of sense for robotic surgery. There's others where it's like a great option, but not 100% necessary. But I think, as a resident and coming from that perspective, robotic surgery is becoming more and more ubiquitous among our field. And, I know now as I'm looking for jobs, I've been surprised by the amount of places that are like, well, are you going to come out robotics trained? Even in like smaller towns, big cities, like the whole gambit. So it's just becoming kind of a more of a maintaining your relevancy. Staying relevant in the world of GYN surgery. And so being able to, we can graduate robotics trained, which is, not every program is able to do that for people. So I was really excited. The robot actually came my second year as a resident. So it's been really exciting to see the attendings learning how to do it and then teaching the residents. And we do have some fellows that come from Stanford who are going to be teaching us. And then also we have a new Urogyn attending who's coming as well, who's also like very, very trained on the robot, very good at the robot, and will also be offering new procedures that way as well. So it's exciting times.
What a really cool opportunity to be able to use cutting edge technology. And then, like you said, staying relevant, staying up on all the educational things that's really going to help you progress as a medical professional going forward, giving you that basis for all of the technology that's to come in later years, I'm sure. Mm-hmm. And then talking about some of the specific cases that you've seen, maybe something unusual, or maybe something that, like you said before, you didn't think you'd get a chance to be a part of, but you were. Is there anything like that you'd like to speak to?
Because of the type of patient population that we have, they're very complex, both medically and socially. And so I feel like every patient, I'm learning something new about from them. And I think the attendings make it a point to even highlight things that you wouldn't even think are considerations. Mm-hmm. And so, I don't know, you're always learning. There's always interesting things to learn, something new to learn from everyone. Even when you see a patient that just seems completely benign and totally normal and there's nothing going on here, it's just a routine visit, there's always a learning opportunity.
Mm-hmm. Yeah. And I think, if we think about like the OB perspective, for example, we actually, like I said, there's very few patients that we can't care for here. So like one of the conditions that, we actually are a center, with a protocol, with the resources to manage on the OB side is something called placenta Accreta spectrum. And so these can be these really, unfortunate pregnancy complications where the placenta, which is an incredible organ that, sustains the pregnancy and the baby, kind of goes too far and grows into structures it's not supposed to, and it can cause these very serious life-threatening situations for the moms. And in a lot of places, if this is picked up, patients have to completely uproot their lives, move to places where there's placenta Accreta centers where they can do the right types of monitoring, and then when the patients need to be delivered, the right types of surgery. But we can do all of that here. And so, like I said, it's just really meaningful because we do have patients that often can be at higher risk of this for various reasons, to be able to kind of keep them in our care and not have to say, oh, you have this, now I have to send you somewhere else, and you kind of lose those patients. So that's I guess one thing I could highlight that I feel like our hospital and our program, is able to offer, and in a county setting. Because I think that's the other thing is a lot of times you're in a county setting, you're a lower resource hospital, but we're a county hospital in Silicon Valley, to not say it a different way. So, and in California, where the social support and the support that our patients get through the public insurance programs are, incredible. And so, like I said, we're able to have these amazing patients, have really incredible resources and new technology to be able to serve them. So it's really an incredible bundle, I feel like.
That was always, I think, the perception that I've heard from people is that, oh, you're a county, a public hospital. What are your resources like? The facilities like? And it's actually very cutting edge here and very clean and just all around amazing. This is so cool to hear because not only are you learning so much and doing these amazing cases and work, which is going to attract people who want to come and train here, but also the community is hearing all of the great ways that they are going to be cared for when they come here as well. So I think that is super awesome. I know we're on a little bit of limited time here, but I wanted to talk a little bit about the family culture. I think one of you mentioned about being in a community of residents together and what that experience has been like for you.
It's just been so, just so gratifying to be with people who are so like-minded and, their approach to medicine, their approach to people, very fun-loving, very just happy, positive. Again, people that, really put their heart and soul into what they do. And then just people that I would love to hang around with, any time of day, which unfortunately we do hang around at all times. You got the 3 a.m., waffle making adventures, those kind of memories with the people that we work with are lifetime. And I really think that, we're there for each other no matter what people need, be it covering for a call shift. I think people really go above and beyond to try to help, especially in residency, people to feel like they have a normal life or be supported when something unexpected happens. If I was to send a message out to applicants is that we really do have a family culture here, and people will give an arm and a leg to take care of you and to keep you, supported and advocate for you. And I've seen that, every year that I've been here.
And Samia, being newer to the organization, but still, I'm sure you've had your share of wild experiences, but also a really familial sense of being here as well.
Yep. I feel like I can go to my more senior residents at any time of the day about any problem. I got a flat tire a couple months ago, and I think it was midnight, and I texted our group chat and I was like, does anyone have AAA? I'm in the middle of the wilderness and it's dark and I have a flat tire and I don't know how I'm going to get out of this situation. And everyone really came to my rescue and was offering help and solutions. And I think just overall, since I basically matched at this program, I have felt welcomed. Everyone has embraced me and really made me feel like I'm part of the team at all times. And if there's an inside joke and I don't get it, someone will take the time and explain it to me. I never feel like an outsider. And so that's been really refreshing to feel like I belong.
And I'm glad you got your tire fixed.
Yeah.
That's great. In the wilderness, too.
A lion did not eat me. A mountain lion. That's what I was scared of.
You're in Mammoth, right?
Yeah.
Yeah.
Going over the Sonoran Pass and I hit a rock and my tire blew.
Wow.
Yeah.
So that is something that I also want to chat about is the area that we're in. Mm-hmm. We're in the heart of Silicon Valley here. with so much city life, but also we're a stone's throw away from where I grew up in Santa Cruz, where you have the beach, you have huge redwood forests. What do you both like to do outside of work with your residents, maybe on your own? What are some of the cool things that you have found?
So I have a 2-year-old daughter. So the things that I do have to be appropriate for a small child. So I don't spend a ton of time in the wilderness. But Tahoe is only a couple hours away. I think Mammoth is a few more hours away from that. You can go up to the redwoods. I have done that. And they're beautiful and I highly recommend it. The wineries are up north from us. I spent a lot of time at the museums. There's a lot of them, especially in San Francisco. There are a ton of great parks around here. Hiking, great restaurants.
I feel like the summary word is anything you want.
Yeah.
Anything you want to do, you can probably find it here. I think 3 hours, you can be you can be high in the mountains, you can be at the beach, you can be skiing. Like the accessibility to all of those things, plus the city, San Francisco and all that has to offer. Monterey with the aquarium that's also world renowned. And then even just San Jose has an incredible array of, good restaurants, good coffee shops. There's some museums here.
Oh, there's a ton of museums here.
I've said that question. I've been to the Children's Museum.
Oh yeah, there's
I think
there's
an Egyptian museum.
And then honestly, if you really needed a weekend trip, it's very easy to get to Southern California.
Mm-hmm.
I go and see my family at least once a month. And flights are really cheap to get down there, round trip, and it takes an hour. So,
what airport do you fly out of?
I'm flying out today from San Jose.
Oh, you are? Okay.
Yeah. And I was surprised because apparently Southwest flies directly to Los Angeles. So it's a 1-hour flight. We're 10 minutes from the airport. So I'm going to leave work, go to the airport, fly to LA, and come back for my night shift on Sunday.
Yeah. That's another thing that I feel like you would never ask as a residency applicant, but it's so huge that we have an airport that is so accessible. It's an international airport. I mean, it's literally 10 minutes from the hospital. So, there's been multiple times this year where I'm I have to run from my shift, but I have an hour and a half to get to the airport and get to my flight and, can usually make that work and make a long weekend happen or, vacation. You can fly, you don't have to drive an hour and a half to get to an international airport. It's right here. And so if you don't live here and you're visiting family, the accessibility when you have the residency time crunch is huge. And it's a really nice airport. It's my favorite airport I've ever been to.
Yeah, I prefer it over
San
Francisco because it's less crowded.
Yes. Yeah.
So it's very easy to get around and also visiting things as a day trip too. And then also living. Even speaking personally, I live 10 minutes away in Cupertino, which is down the street from a lake. So you really do get to, choose the environment that you want to live in as well. Is there anything you wanted to mention about, proximity, not only to the hospital, but also to fellow residents or, just a nature or city that you like to be near?
I live outside of San Jose in Union City just for commuting purposes for my partner. But I feel like it's relatively easy to get into San Jose. I can also get into Oakland in 20 minutes. I can also get into San Francisco pretty easy. I'm across the bridge from Palo Alto. I feel like Northern California seems like it's this big spread out area, but it's not as big as you think. And it's not as big as it looks like on a map. It's actually much smaller. Things are a lot more accessible than what they look like.
Sure. I'll be in LA, tomorrow, just 6 hours away, which
it's 4 hours.
Is it?
Yeah.
I drive slow then.
Oh, it's 4.5. If you take the 101, it's 6 hours. But if you take the 5 straight down, it's 4.5.
Okay. Yeah. I take the scenic. You can drive the coast.
Yeah. Oh, there's nothing better than Highway 1. It's incredible.
Yeah. That is true.
The 2 hours. But yeah, I guess so. I do live in San Jose. And I think most residents live within 10 to 15 minutes. But the Bay in general is actually really, a lot of people commute in various directions. And, we've had residents who've lived in San Francisco, Palo Alto, Daly City, Union City, all over the place that commute. And it's really easy to drive. You get free parking, which again, is not the case everywhere. So, that way it's really a nice situation. There are some people who live, like I just wanted to be within like 10, 15 minutes because I'm lazy. I didn't want to have to commute too far. But there's like some people who've lived within like a few blocks and, there's really nice neighborhoods and people will walk to work, bike to work, just within the program. So I think you can find very, like a spectrum of places that you'd want to live, house, apartment, closer to the mountains, closer to downtown. Like people kind of just live everywhere.
Yeah, I think within my class, I live on the East Bay side. We have someone else who lives on the peninsula, and then the remaining two are somewhere around San Jose. So there are a lot of options available.
Mm-hmm.
And I have one last question for you both. This may be the hardest question. Sorry to challenge you right here at the end.
Get some more coffee.
But your favorite part about being a resident, out of all the things we talked about, it may be challenging from the places that we go and live and see, but also the medical side of things and the cases. If you had to pick one thing, what made you want to be here, or what makes you the happiest to be here now?
Would it be the boba?
What?
We drink a lot of boba in our program.
Boba's great.
We do.
Yeah.
We do drink a lot of boba. And I think that's a very valid answer.
It's not my answer. It's what I actually am loving about being a resident. I think that something that has surprised me about being a resident, but something that I have enjoyed, I didn't realize how much I was going to like it. I thought I was going to be miserable. I was going to be tired. I was going to be overworked within the first few months. You hear from people who recently graduated medical school and started their intern year, and they're like, oh, intern year is horrible. I haven't felt that way. I think that is a testament to how much support I've gotten in the first few months of residency, but I enjoy coming to work every day. I enjoy the learning. I like who I work with. I love the patients. They're so grateful for just, helping them through their most vulnerable moments in life. And I think those are my favorite moments. I can't say there's like one particular thing over the last few months that I'm like, oh, this is the thing that makes me love being a resident. I think it's all of it. And it's partially attributed to the environment and the program that I'm in.
Liking coming to work and the people that you work with.
I do like coming to work.
Speaks volumes to any job. So that's great to hear.
Yeah.
And anything the same, different for you, Natalie?
Yeah. I mean, I would definitely agree with everything you say. I'm trying to think if there's anything particularly distinct. I mean, I think like one thing that really drove me to this field in general, or attracted me to being a OBGYN, is that I really like variety. And, I think I can get a little bit like when I feel stagnant, like doing the same things, it doesn't feel as rewarding. But OBGYN in general is like, you can be delivering a baby 1 minute, then the next minute you're in the ER with something like really acute. And then the next minute you're in the OR, dealing with, some other type of emergency. And you really, can offer such broad care to people, to women. And this program just has variety on all levels. And it's really exciting. I feel like I'm going to leave here very prepared to kind of face whatever challenges come at me in the next phase. So I would say, I don't know, I think that's kind of my one thing is the variety here and how prepared we're all going to leave here.
I love to hear that. And as, two people who obviously love this program, it's so encouraging to hear, not only for people who are considering this program, but for the community that you serve, that, there are such amazing people that work here and serve here and have such a heart for the community that they serve. So that's really cool that people get to hear that message. We thank you so much for taking the time to highlight Santa Clara Valley Healthcare and all of our hospitals and clinics, and specifically the OBGYN residency program. Natalie and Samia, thank you so much. Episode 1, fantastic.